to where you are introduced.
He will introduce himself very well.
Okay. Okay.
And I need to put. Okay, I'm going to stop the recording because. Yeah.
You're sharing. Kila, stop sharing all. Good.
Right. We're exactly 10 minutes past 6. I think it's about time we start, so don't keep our attendees waiting. Good evening, ladies and gentlemen. My name is Dr. Valentine Ngwa. I'm a CamDoc member. I'm also a physician, a consultant physician in the United Kingdom, working in acute medicine and elderly care medicine. And I'm also a researcher, doing a lot of research on elderly people. I'll be a moderator today, and helping me in the moderation service will be two of my co-moderators, Dr. Linda Bello, who is also the chairperson of CamDocUK and is a family physician here in the UK, and Dr. Anam Bene, who is a chemical pathologist working in the same hospital as myself in Wakefield. There they are on your screen. So they will be assisting me as we moderate this very important topic of lifestyle medicine. And we can wonder why we're interested in this lifestyle medicine. There's a lot of evidence to show that the things we do daily has a significant impact on both the short-term and long-term health and quality of life. And what are these daily habits? I wouldn't spill the beans. I will let our panelists be able to tell you the pillars of lifestyle medicine. They'll be in a better position to tell you about all those. But these daily activities we're talking about were incorporated into our lifestyle. There's a lot of evidence, and it's being used in many guidelines today. Like if you read the American Heart Association guidelines, you will see lifestyle medicine incorporated in our daily activities to prevent heart diseases. But frustratingly, the uptake can be quite low. And I'm going to quote 2020 evidence from the Americans, particularly from the American Heart Association, which show that just about 5% of the Americans actually do incorporate all these pillars into their daily lifestyle. But why is it important? There's a lot of research on that, and I'm going to let our panelists talk on that. But just let me speak on two. There was a study done using nurses called the nurses study that looked up their lifestyle and their health outcome over 20 years. And they show that if you incorporate this habit, you have about 80% chance of preventing heart diseases and about 91% chance of preventing diabetes. And we'll talk about type 2 diabetes here mostly. And even if you don't follow all of the 6 pillars, which our panelists will talk about, if you follow just some, there's still some benefit. And this was also shown in another study called the US Professional Study, which showed that it was looking at professional men. Of course, if you follow all these pillars our parents are going to talk to you about today, you have this dramatic prevention, as we'll talk about in the nurses study. But if you do only one of them, you have almost a 50% chance of preventing a heart disease, which means, therefore, that it's very important that we listen to this, see what these lifestyle measures are, and if we're not incorporating them into our lifestyle, then we need to consider doing that. So what is lifestyle medicine? Somebody might ask. Again, I will not spill the beans. I'll let the panelists talk more on that. But just to put it in a brief context, it is that discipline where we study how our daily habits and practices can impact both on the prevention and treatment. I want to emphasize on that, prevention and treatment of some of the common diseases, particularly the non-communicable diseases this could happen in conjunction with medications, with surgery, or on its own. Our panelists will be able to explore that in detail. So without being able to delve into what we've already brought the experts here to speak, I would stop the introduction there and say, we're going to now move ahead. And today we're going to have 4 speakers, 4 fantastic speakers. I'm going to introduce them fully as we go along. But just to mention, we're going to have Dr. Ifeoma Monye, Dr. Phyllis Navti, Mrs. Kila Konje, and Mrs. Ula Abunaw. I'll do a deep introduction as we go along so we know why they are important to be on this panel today. But before we kick out with our first panelist, let me do a bit of housekeeping. On your screen, you'll see a Q&A section at the bottom of the screen and a chat section. If you want to discuss the things that are going on, the points that you're picking up, and add some word to it, you can use the chat section. But if you want to ask a question, please use the Q&A section. With our co-moderators and myself, will pick up some of these questions. We can answer some at the background. The panelists can answer some, or we can leave them and ask the panelists. So what will happen will be, after each speaker has spoken, we'll pick 1 or 2 questions and ask the speaker. However, it's going to be a bit different today. Dr. Monye, in her very busy schedule, and we're so thankful that she'll be able to give us the time to come and speak here today, will be leaving earlier because she's got the call of duty. So if you have any questions for her, and she's going to be the first speaker, you can ask those questions, also she can take them before she leaves, because she might leave before the end when it's going to be the Q&A session. If you could do that, I'll be very grateful. And having said that, ladies and gentlemen, let me introduce our first speaker for tonight. It's going to be my honor to introduce Dr. Ifeoma Monye, who is a globally respected physician, a pioneer, and a visionary leader who has established the specialty of lifestyle medicine in Africa and continues to shape its growth across the continent and internationally. She is the president of the World Lifestyle Medicine Organization, bringing together countries from all regions of the world, and has dedicated her career to advancing the prevention-centered healthcare as a foundation for sustainable health systems. We now know how healthcare is expensive these days, so if we can get this health system that depends more on prevention than curative, then we can actually get healthcare that we do need. But that's not all. She has many hats. She's also the founder, president, and co-founder of the African Lifestyle Medicine Council and the founding president of the Society of Lifestyle Medicine in Nigeria. So you can see she's been very, very busy, very, very active. And we're so thankful that she's here today. She bridges the gap between Africa and the diaspora as much as science, strategy, policy, and practice are involved. You can imagine we can say all these things, but we need to put them into policy. So today she'll be talking to us about why lifestyle medicine is no longer optional for African and the diasporan health. So ladies and gentlemen, join me in welcoming Dr. Monye. Dr. Monye, thank you for being here. The floor is yours.
Thank you so much, Dr. Ngwa. Can you all hear me very well?
Yes, we can hear you very well. Yes.
Perfect. I bring warm greetings from my family and from all the organizations that I represent. I want to thank the CamDoc, Cameroon doctors in the UK, who are doing a great job, looking at the needs of our people, both at home, but in the diaspora in particular. I bring greetings from the African Lifestyle Medicine Council, and Dr. Sambar is here, who is our secretary. I bring greetings from the World Lifestyle Medicine Organization. I bring greetings from Society of Lifestyle Medicine of Nigeria, which is my primary constituency. So I bring greetings from everyone. This evening, I want to very quickly, and I'm glad they gave me just 15 minutes to talk, because if you didn't, I'll probably talk for 15 hours. So I'm going to quickly touch on issues, just to inspire you, the listeners, wherever you are in Africa, in UK, in the US, wherever you are in the world, you need to be inspired, because this is a time to really do something about what is ailing our people. The topic I'm going to be sharing on is lifestyle medicine as the foundation of healthcare in Africa and in its diaspora. Evidence, urgency, and strategy. And a lovely lady is going to be helping me share the slides as I just fire on. So I have been known with so many quotes, but there are some that I particularly chose for this talk because they are very relevant. Next slide, please. Lifestyle medicine is not an alternative to healthcare. It is the foundation. I also like to share that healthcare systems that focus mainly on treatment cannot defeat diseases that are largely preventable. And as Dr. Ngwa let us know earlier on, 80 to 85% of all chronic illnesses are based on our lifestyles and can be prevented by our lifestyles. This is solid science backed. Lifestyle medicine offers Africa and its diaspora a new foundation, one that is built on prevention, reversal, and sustainable well-being. Next slide, please. Why this conversation matters now. In Africa and the diaspora, we are really everybody infectious versus lifestyle diseases, or communicable versus non-communicable diseases. But when we think about climate change, that is a burden. When we think about the strife and the attacks and the wars and all of that, tension, diabetes, and therefore, because we carry it for much longer, it is more severe. Am I breaking? Somebody said I'm breaking.
Yes, you keep breaking up from time to time, but we can hear you now. Just carry on, doctor.
Yeah.
Can you hear us, doctor?
$0.01 was released for what the health minister required. Can you imagine that? So the health minister had asked for something in the neighborhood of maybe 30 billion or something like that, and it was only given 350 million.
Would you
You have
apologize?
to be extremely careful. Are you okay?
You were breaking up, Dr. Monye, but we can hear you fine now. Carry on, please. Okay.
In the diaspora, it's particularly terrible because there is a disproportionate impact on diasporan populations. Next slide, please. So the current model is unsustainable. What evidence do we have that lifestyle drives disease? Dr. Ngwa has already helped very much by citing the nurses study. That is a very popular study that is cited everywhere. And if you're one of those who take the exams, the certification exams, you better know that study like the back of your hand. Where up to 80% of chronic diseases are preventable. And the major drivers will remain our diet, our physical inactivity, tobacco and harmful substances, and harmful behaviors, I dare add, chronic stress, poor sleep. And we find that the common chronic illnesses that go with these things will be the things that we know. I'm sure either you or somebody we know, if I ask everyone in this meeting to raise up their hand if they or somebody they know has at least one of these conditions, there will be no hands that is not raised in this meeting. So with hypertension, diabetes, cardiovascular disease, obesity, certain cancers, the list goes on. There are people who in Africa, it is dealing with the population. And we know that the causes of most diseases will remain behavioral and environmental. Next slide, please. And, when we look at the evidence from Africa, next slide, please. Yeah, thank you. From Africa, we know now that NCDs account for approximately 37, just call it 40%. And so it makes more sense in your head, of all deaths in the WHO African region. Before, we used to think about this elite, quote and unquote, diseases as that of people from the Western world. But because of a lot of things, which I'm sure all of us here know, it's tilting to the other side. Hypertension prevalence is among the highest globally among African and in the diaspora, and is often undiagnosed. Those who live in the diaspora, you understand the system, you understand the rat race, and most of the time your health is the last thing you're thinking about, because many people in the diaspora are holding on to 2, 3, 4 jobs. So they are going from one job to the other, to the other, to the other, to look after their families, to pay their bills. You pay your bills in the diaspora. It's not like in our motherland where you can avoid all these things. You pay your bills, and then you send money home to help people at home. So people are holding on to so many jobs that brings stress, that brings poor or no sleep, and that brings a lot of these chronic illnesses. There is rapid urbanization in the motherland, accelerating lifestyle risk exposure. And so any which way you look at it, the trouble is here. We already see children in Nigeria with type 2 diabetes. Can you believe that? And of course, cardiovascular disease are higher compared to places with high income. In the diaspora, I answer both to the diasporan group as well as the people in motherland, because I share my time in both places. But we find that when you come to the diaspora, the African and the Caribbean populations experience higher rates of hypertension and stroke. You have them come on more earlier in life, and you have more aggressive versions of them. When you look at what happens in diaspora, people come over here in these days majorly legally. But years gone, people just come here on a visitor's visa, and they remain, and they have to keep looking at their back to make sure that ICE is not chasing them, or that home office people are not chasing them. And so they're in constant stress. So there's migration stress. There is structural inequities. And there is, I don't need to go into that. Then, of course, there is lifestyle transitions. As we move from Africa into diaspora, the food you are used to is not easily available here. Even if it is easily available, I dare question the quality of that food that has traveled several thousands of miles across the sea, across the air to come to you, with lots of preservatives, I dare say. So even the quality of food, and I'm not here to scare anyone, is the truth, the quality of food that we consume in the diaspora, leaves a lot to be desired. It may look very fresh and all of that, but these are the realities. And there's disproportionate burden despite access to advanced healthcare systems. We know that is what the local statistics show. Next slide, please. So the burden is rising on the continent of Africa and intensifying in the diaspora. I've already shared some of this, where when we come into the diaspora, we meet with Western disease patterns because of the food, because of the sedentary lifestyles, because of all the poor sleep and all the pillars of lifestyle medicine. But we do not have necessarily the Western health safety nets. In the UK, it's even better for us because we have the NHS, where as long as you do your thing and you're right standing, you have no problem registering with the NHS and having primary care cover. But there are countries in the world, the US is one of them, where there isn't such free Christmas treatment. You pay for your healthcare. And you know that apart from the fact they're hiding from authorities, they can't even afford it. So many of our diasporans will necessarily be disenfranchised as far as their health is concerned. They're hiding, and before they even present, maybe with a complication of stroke. Meanwhile, they've had hypertension for 10, 15 years without being properly managed. And so we find that all sorts of things are happening, even the preventative care. And now this is my passion, going all over the world to talk to our diasporans and say, hey guys, these are the things that are facing us, and we must do something about it. Next slide, please. What is lifestyle medicine? It's already been told you. It's basically a very new discipline, but very fast evolving as well, that focuses on prevention, treatment, and reversal of chronic illnesses using our daily lifestyle habits. And based on 6 pillars of lifestyle medicine, if you look at the 1, 2, 3, 4, 5, 6, we have diet of whole food, plant predominant nutrition, we have relationships and connectedness, we have exercise, regular physical activity, and we have avoidance of risky substances and risky behaviors, and the mental well-being and management of stress. And finally, we have sleep optimization. If you put all this together, it forms the DREAMS framework, which I have curated, and which the African Lifestyle Medicine Council, as well as all the societies that are in Africa now, and including Nigerian society, South African society, Botswana, Egypt, are all helping to make famous and make known that using the acronym DREAMS, you will always remember the pillars of lifestyle medicine. So we have studies, and I'm not here to really go through them because of my time, that talk about how we can reverse type 2 diabetes and all the other conditions. And guess what? The benefits go beyond disease reversal. It goes into reduced healthcare costs, into improved productivity, and stronger, I dare say, families and communities. Next slide, please. The urgency is now. The urgency is now, because if we do not act, and on the pillars of lifestyle medicine, if we do not act to change our behavior from what we used to do, change our food from what we used to eat, change our sleep pattern from the way we slept, change our physical activity pattern from the sedentary lifestyle we led, we are going to just walk into these chronic illnesses one by one. And they're all interrelated. We know that chronic inflammation is the final common pathway of all of these chronic illnesses. And that is something that lifestyle medicine targets. All the pillars, when properly implemented, when properly operationalized, it will either prevent, if you don't already have it, or it will slow down or reverse it if you already have it. And that is what we are seeing in lots of conditions that are based on primarily on chronic inflammation. And so we see, what will actually fall out is that health systems will be completely overwhelmed. And they're already overwhelmed now, so you can imagine workforce productivity decline. The younger generations are facing earlier morbidity and mortality. I say this with a lot of sadness in my heart and in my head, that my parents lived till 90 and 91 respectively. But unfortunately, I've lost 2 brothers in the last 3 years who passed away at 61 and 64. So, and I'm not alone in this. Look at families. People are not living as long as their parents anymore, or their grandparents, even though they are so much more exposed to high healthcare resources. So lifestyle medicine is not optional, it is essential. Next slide, please. Thank you. So we would have to go through a couple of strategies. We need to re-engineer healthcare systems. We can talk all we want, but if the policymakers are not part of this conversation, nothing will change. We'll be having jamboree year after year after year. We need to begin to engage with our policymakers back home and even in the diaspora to change from disease care to health creation. Here in the UK and in the US, because I'm a fellow of the American College, I'm a fellow of the British College Society. I know that I have been in the forefront of getting these things to the ears of the policymakers, and a lot is happening in these 2 countries. So we need to get them involved. There should be integration of lifestyle medicine into primary care, preventive services as standard practice. And the thing is, there has to be a different modality to reimburse those who bother about preventive care. And lots of community-based interventions are actually ready to start because these things are already happening in the community. They just need to be formalized into formal pathways and frameworks. Next slide, please. The next strategy, and a very important one, the one to actually start with, is to train the workforce. You cannot practice what you were not taught. And so we're at the beginning of all of this in the year, say 10, 15 years ago when we began this movement globally. Many of us were saying to ourselves, I think we should really start with training healthcare workers, because they are the ones who are going to train others, who are going to train their patients. We were not taught this in medical school. So there should be lifestyle medicine education in medical schools. And those who are already doctors should go back and train. Is very important. You'll be surprised what you will learn, what new things you will learn. And then the multidisciplinary.
Apologies, I think you've frozen again.
Disciplinary teams, of course, all of them should be trained in prevention. Next slide, please. Let us empower communities in all these ways: public health education, faith-based. Africa is known for faith. So faith-based and cultural institutions as partners. Workplace wellness is now being ramped up. There's policy and leadership involved. We will need to have national prevention strategies, regulation of harmful industries, urban design for active living, and food policy reforms. Can you give me the next slide, please? Because it is only when leadership shifts. Can you hear me? Can you hear me?
Yes, we can hear you. You were breaking up there, but we can hear you now.
Okay, great. Can you? Okay. Policy and leadership, I've run through that. So, and then food policy reforms. We must shift the thinking of policymakers to get where we want to go. What is the role of the diaspora? You have a huge part to play. The diaspora is a bridge for transformation. It was from the diaspora that I left and in the year 2002, went back to Nigeria to begin this movement. So it was the knowledge I got from diaspora that I took, knowledge transfer, and began to do something in Nigeria, and now it's spread all over Africa. We now have about 11 countries: Nigeria, South Africa, Botswana, Egypt, Zimbabwe, Zambia, Kenya, Ethiopia, Malawi, Ghana, and drum roll, Cameroon. Yes, we have Dr. Ngwa, who is a Cameroonian, as a member of the African Lifestyle Medicine Council. It is a council of country membership, not individual memberships, but she has been representing Cameroon. And I just said to her before this that now that, and I said also to Phyllis, that now that you are so many who are keen on lifestyle medicine, you must be the next country that establishes your own society, your own association, or your own academy. So you call it whatever you want to call it. If you call it academy or association, then you're looking at CAM, which is Cameroon Academy or Cameroon Association of Lifestyle Medicine. That's a really nice mnemonic to have, because lifestyle medicine should really bring calm, to your life. But oh my goodness, please choose whatever name rocks your boat, so you can choose. So we are very, very strategic for knowledge transfer. We are also very strategic for investments in prevention initiatives and for advocacy and research, and of course, building global partnerships. I don't have time. I would have given a solid example of every single one of these that God has helped me to put down in my country, Nigeria. So we are a bridge to transformation. Next slide, please. And so as I round up now, I have given a lecture. Hello?
Yes, we can hear you.
We
Okay,
can hear
please.
you.
Next slide, please. As I round up, there's a lecture I've given so many times in international conferences, Africa Dreams. And you see, this is the acronym for the pillars of lifestyle medicine: diet and nutrition, relationships, exercise, physical activity, avoidance, management of stress, mental well-being, and sleep optimization. Africa dreams of hospitals focused on health, not illness. Communities equipped to prevent disease. Africa dreams of children growing up with healthier norms. Africa dreams of leading a global prevention movement. Next slide, please. And prevention is actually what we can afford in Africa. And finally, I hope that everyone under the sound of my voice, among you, clinicians should practice it. Educators should teach it. Researchers should research it. There's a lot to research in Africa because the data from our continent is very, very sparse in the discipline of lifestyle medicine. So you are all welcome to research. Please embrace it because we need lots of data from Africa. And then policymakers amongst us, please support it, and communities must demand it. Lifestyle medicine must become the foundation of healthcare, not an added optional thing. Next slide, please. In closing, again, I bombard you with my quotes. Prevention is the cure we have been waiting for in Africa and the diaspora. And as a key message, if we build healthcare on lifestyle medicine today, we will build a healthier Africa and diaspora for generations to come. Africa of my dreams is possible. Where people are living healthier, happier, and longer. Next slide, please. These are some of my selected references. And next slide, please. If we build healthcare on Africa, lifestyle medicine, today we will change destiny of generations yet unborn. And my final slide, next slide, please, is just a resource I want to share with everyone as I leave you calmly now. And, it's a book that was published by Wiley Blackwell. Many of you will know this is the star publishers for medical resources in Europe. And it's lifestyle medicine book to get ready for the International Board of Lifestyle Medicine and any other lifestyle medicine certification exam. The second edition is being touched up. We have almost finished. These are my lovely colleagues on the picture there. We've almost finished with the second edition. I need to be released before this year runs out. And it has a huge portion taking care of the lifestyle medicine accreditation of the UK, lifestyle medicine, LMCA of the UK. So the book, second edition, is quite robust. Lots of new questions to reflect the way the exams are changing and the way knowledge is advancing. So you're welcome to get this book on Amazon. I am the lead author with my lovely colleagues with me. Thank you so much, and I'm very, very delighted to be here. Thank you for inviting me, and I want to be hearing excellent things about Cameroon. I can't wait. I'm waiting. I'm all ears. Thank you. And I can take questions.
Thank you so much, Dr. Monye. That was a stellar presentation. I do apologize to our attendees for the little breakout that we're having, but I'm sure we all got the gist. Now, there's a few questions for you, but I'm going to ask you. I mean, I was glad when you said quite a few things. One of them was the fact that it could be a preventative measure. Lifestyle medicine could be a preventative measure, could also be a reversible measure where it could reverse chronic diseases. Now, I mean, you are a family physician as well. So how could you just highlight our attendees when somebody who has already been diagnosed with a chronic disease has now engaged in the lifestyle medicine pillars? How do we make sure that the disease monitoring is adequate? Because what we get nowadays is people who are not quite versed with this just think that if you start drinking a few sober drinks in a day and jogging around your block, and then your diabetes goes away or your hypertension goes away, and the next thing you see them in hospital with a complication of their disease. So monitoring while you are changing your lifestyle, what will you advise on that?
Thank you very much. A very, very good question and a very fundamental question for a new discipline like lifestyle medicine. And as you say, yes, many people, they've had a bit of lecture, webinar here and there, and then they jump in and things can go awry because of that. So first of all, along with studying or training is so important. We must, as physicians or healthcare workers, seek training that serves us. I'm not going to mention any training at all. There's no time, but there's lots of training. Some are completely free, others you pay something at different levels. So you can have another webinar to discuss training. Training is so important. I got into lifestyle medicine in the year 2000, and you can imagine. I went there like a green. I was what's all this? But I have learned a lot. I've trained a lot. I've trained many people as well since then. So you train and you train others, and in training you understand that health coaching is like 10, 5 and 6, as we say it in Nigeria, with lifestyle medicine. Behavior change is the bottom line. And in health coaching and behavior change, you go with the person, the client or the patient, as the case may be, along their journey of change. And so there are different programs. And really, this is such a pertinent question because it's not about just learning about lifestyle medicine, but about how then can you implement it. So yes, doctors should train, nurses should train, everybody should train, and then also train how to hold a patient or a client through the process of change and how to sustain that change and make sure that when it is time to say, no, as you come now, you've had diabetes for 20 years, likelihood of reversal is very slim. Let us know what we can do in instilling, that kind of thing. So thank you for that question. But it's full. The answer is so full. But there is a way to go about it to prevent the bad things that happen that you mentioned.
Thank you so much. I think that was very appropriate response. And now there are quite a few questions on training. I think our next speaker will be talking about that. But we'll let Dr. Monye have a sip of water. You've had tell us, we do appreciate your time. We appreciate your expertise and knowledge. And I'm sure there's a lot of pointers that you've put there, particularly that on policy on food, which is very important. As I keep saying, when I speak to my colleagues, I keep saying, sometimes I think that Africa imports the kind of food that is like a poison to their people without actually knowing it. But one thing I want to emphasize before I leave Dr. Monye is the fact that you said chronic inflammation is the bottom of what we're doing, and that's quite true. As an old age physician, chronic inflammation is the bottom line of the diabetes, the hypertension, the stroke, the heart diseases, the dementia that we're getting. So lifestyle medicine as a means of curbing this chronic inflammation definitely is a win-win. Once more, thank you so much for being on the webinar. We do appreciate your time. I know your time is very precious and you are on duty today. We will let you go, but if you want to stay behind and probably answer some questions by typing, that will be very helpful as well. But thank you so much. I do appreciate it and nice to meet you. Thank you.
Thank you. All the best. Thank you.
Thank you so much. Now, Dr. Monye did say you cannot practice what you're not taught, which I definitely agree on that. And our next speaker will be somebody who is quite instrumental in that teaching. And I'm talking about Dr. Phyllis Navti, who also wears a lot of hats. She's a clinical pharmacist, currently based in Doha, but I can tell you she gets around the world, including Boya, where she has a lot of interest in education. She's a healthcare educator. She's a lifestyle medicine practitioner. And she's an author. Look, I'm going to just pause here and just show you my own copy of her book. Okay, so it's available. Fantastic book. I'm going to show you at the end again. She's an author and she's the founder of AfroFusion Lifestyle Coaching. Now, she's quite interested in teaching, in pioneering the younger ones to be able to take on this discipline before they get out into the job market. So she's been training future pharmacists through the lifestyle medicine lens. She's gets them to demonstrate the learning, and I'm sure she's going to show one of the videos to you here. So she's highlighting in her talk how we can educate tomorrow's clinician to transform care for generations. And as we just heard from the first speaker, lifestyle medicine is a very important aspect in how we transform care. So Dr. Navti, it's a pleasure to have you here, and I'll let you have the floor.
Thank you, Dr. Val. Okay. Sorry. I had it ready and then it disappeared on me. Okay. There we go. Can you see my slides and hear me?
Yes, you can hear, you can see your slides.
Okay, hello everyone, and just thank you so much for joining us today. I just want to thank CamDoc, this dynamic bunch of CamDoc doctors who invited us to talk about lifestyle medicine today. It's always a pleasure to be here and just joining the amazing work you do. Thank you everyone for joining, and thanks my fellow panelists. Dr. Monye, I think, has left. So it's a hard job to follow her because I've attended the Lifestyle Medicine Conference for the last 5 years, and she's always a keynote speaker. And she ended the second time I went to the conference, she had everyone dancing and singing, and she inspired me. So it's a hard job to follow her, but I'll do my best. So I'll be talking about why lifestyle medicine must begin in healthcare education. When I say framework, it's a big word, but it really just little strategies to get us thinking where lifestyle medicine should begin. Should it begin in the clinic or should it begin in education? And like Dr. Monye said, you can't practice what you were not taught. So obviously education. So to get us starting, this is the bit I'm slightly nervous about, but we'll get this going. So technology, right? So to get us starting, I just want to ask the question, how confident are you in helping yourself, your family, or your patients make real lasting changes for better healthcare? So lifestyle changes for better healthcare. We're going to use a Mentimeter as the first option. If you can, take out your phone and just use your scanner function and scan the bar. Give me just a couple of seconds and I'll switch over and to the Mentimeter so we can see the responses in real time. So please just scan this QR code. For those who are struggling to, the questions will be put in the chat. So you just need to type the number corresponding to your answer. So how confident are you in helping yourself, your family, or your patients make real lasting lifestyle changes for better health? So very confident, 1, somewhat confident, not very confident, 3, not confident at all, 4. So I'll share, I hope this works, the Menti, which is this one. And then when I start, you should be able to. So the 5 players ready. So I'll just wait for a few more to join and then I'll start the quiz and then you should be able to start. So quickly. And if you're not able to, please just type 1, 2, 3, 4, or 5 on the chat. It's a couple more seconds and then I'll start the quiz. I was hoping for a bit more. So the 50 people in the chat, there's just 6 players. So might not be working for some. Okay, more people. Yeah, getting a little bit more. So I'll start the quiz anyway. That should give us representative and to save time. Okay. So just counting down, getting the answers. Everyone has voted. Okay, so very good. So it shows that a lot of people would went on very confident. They already do this. 3, so let me see, about good majority, somewhat confident, some not very confident, and some not confident at all. I don't know where to start. So hopefully this would help those who are not very confident at all. And I'll maybe go back to my slide and we'll take it from there. I'll just quickly see what's in the chat. Okay, so we have 2, 2, 1, 3, 3. So a lot of people are confident. This is really, really great. So we're all on the same page. So yeah, we have 2, 1, Amina, Beneza, Eustace, Susan, Abby, yeah, Gabo, Evelyn, Ore, yeah, 1, 2, Kila, Abby. Very good. Thanks, guys. So this is really encouraging. So a lot of people are confident, and that's a great place to be. Quickly to talk about lifestyle medicine training in healthcare practitioners. So kind of, Dr. Monye talked about how important it is for us to train. So those who are teaching to train, doctors who were not trained to go learn a little bit about it. But looking at the data, it shows us that lifestyle medicine, it's not the definition of lifestyle medicine pillars, the evidence base, how to take histories for lifestyle medicine, see how patients are doing, is not taught in a lot of the healthcare practitioner training. So medical training, pharmacists, nurses, strategies on how to manage patients based on lifestyle medicine principles, not taught. Behavioral change, which Dr. Monye talked about, which is so important to hold the patient's hand and support them. A lot of healthcare practitioners are not taught how to support patients with behavioral change and prevention planning. What we all know is taught a lot on is how to, do full diagnosis based on symptoms, go on and prescribe medicines or surgery. So that is something which is the focus of most healthcare education. We know that. And basically, when a lot of the data shows that lifestyle medicine is not practiced by healthcare practitioners, it's not because they want to ignore prevention. It's just a competency gap because it was something we were not taught. I went through pharmacy school, never learned about all of this stuff until maybe 15 years into my practice as a pharmacist. And patients don't expect that, lifestyle medicine discussions to happen. So again, because this is important, this slide touches on that a little bit more deeper. So a little bit about cause and effect. So nutrition education, the data shows that the average time spent teaching nutrition is 19 hours in the whole medical school education. So less than 25% of schools meet the recommended 25 hours. So the recommendation is that as doctors in training, you should have at least 25 hours of nutrition education. But reality is that most schools don't teach this. Physical education, nothing at all. So it's very minimal. In most schools, doctors are not taught how to practice, how to prescribe exercise as treatment. They know, but they don't know how to actually go about practicing, prescribing it so patients do it safely and also that they can be monitored. Behavior change, a lot of the education, the curricula don't teach anything on behavior change. So it's something that really is missing in a lot of the education. So the effect of that is obviously that healthcare practitioners lack the tools and strategies to be able to actually support patients with this. They feel uncertain. So they know the pillars. A lot of the pillars are common sense, but they don't know how to go about actually using it. And the default, again, the time is a barrier because they have such a short time to be with the patient. The default is take a prescription pad and prescribe. Patients expect and love medication. So they love doctors who prescribe a lot, or they love pharmacists that they go to and they come out with a list of medication because patients don't know that sometimes it's better not to have this medication. There are times you need it, but a lot of times maybe not. And then the other consequences, Dr. Monye talked about non-communicable diseases, so I won't go into that. So basically, there's an urgent need to add lifestyle medicine into curriculum, right? So that's the effect. So now, I don't know if a lot of you, this sort of resonates with you, this picture, where you see a happy patient goes in to see a doctor. I know my mom, when you go see a doctor and you come out with a long list of prescriptions, certainly before I started doing the lifestyle medicine, the more medications you get, the more effective you think the doctor is. You think they're well-trained, they're experienced, they're skilled because they give you more medication, which is not often the case. So the gap is not resistance, but exposure. So the ideal way, quick solution on how to integrate lifestyle medicine in healthcare education, it would be great if we can do all of this. First thing is to identify the need and align priorities. So Dr. Monye talked about policies. So go about it, speak to the leaders and get all the discussions going at the national level, make it a priority. That would be ideal, the first thing to do. The second, define the core lifestyle medicine competencies for all the different healthcare practitioner groups, like what do pharmacists need, what do doctors need, and then agree what to teach. Emphasize interprofessional collaboration and, make sure behavioral change is included. And then train the educators we would then go on and train the students. And once that is done, embed it into the curriculum. So it's something that happens all the time, and put it as part of existing courses. So it's not a standalone new one. So I think a lot of public health teaching happens already in healthcare education. So to maybe integrate it within that, so it's not a new thing. Right? So it is something that should happen, and it should be supported by national vision. But whilst waiting for utopia, for all of this to happen, there are little things we can all do in our silos, wherever we are. And this is what I try to do when I had the opportunity to go to work with the University of Boya when they opened the new pharmacy school. So I jumped on this when I was offered to go teach a course. And it was one step towards integrating lifestyle medicine in Cameroon. So I took, 2 weeks of unpaid leave, went to Cameroon and had, taught for about 7 days. I had 6 sessions over 7 days. And I ran through all the different pillars of lifestyle medicine, and I'll talk about that shortly. So from introduction of lifestyle medicine to the final one when we had exams, this is my beautiful class. So it was the best thing I've done, like the best teaching experience I've had, going and meeting this wonderful little group of students, all very amazing. So it was just really great. So that's the class, the first year pharmacy class in University of Boya. So on day one, what I did was, getting to know the students. So I had an icebreaker. I asked them to think about the health hero, and ask them to think about why this person is their health hero, to introduce themselves and tell us who their health hero was. So I spent about 2 hours just really getting to know them, because lifestyle medicine, as Dr. Monye said, is about working with the patient. So you have to know people. So basically, a lot of the students, summary of what they came up with when I asked about them, a lot of them said their moms, their dads, their uncles were their health heroes. So just to say to us that the way we practice our lifestyle and how we teach our children, we become their teachers at home. So everyone here can be a hero for their, family. A lot of them, like 3 of them, had their fathers were traditional healers in Cameroon. So they talked about that a lot, and that was really interesting discussions. I don't have time to delve into it, but they actually were quite, they knew about the fact that traditional medicine has its place. Lifestyle medicine is about, some of that, there's an interface, but their concerns were about the blurriness between victimization when their dads, who were traditional healers, will go into the zone of saying to people, oh, your auntie made you have diabetes. And then that sort of had its own side effects. Mental health well-being was a key issue. So a lot of them were struggling from all sorts of things to do with internal displacement because of the issues we have in Cameroon, financial issues. Some actually had social phobia. I thought it was something of diasporan children, but in Cameroon, it was a problem. So they have a lot of mental, they were struggling as well. Stories of insomnia. So it was really enlightening to understand that lifestyle medicine is personal, is contextual, and is urgently relevant. I also, on day one, we looked at the definition of lifestyle medicine. Dr. Ngwa talked about it already, but I'll just highlight here, again, the pillars. But I just want to point here that lifestyle medicine is evidence-based. So it's not something that is focused, there's evidence around it. It's just my timer telling me about, I have a few more minutes left. It's person-centered. So it's not something that's abstract. It's about the person. And it's something which talks about, so it's got all the different 6 pillars, but it's just to say there is a lot of evidence for lifestyle medicine, and it addresses the root causes of diseases. Day 2, I taught the students about nutrition. So I did these little games with them where it was nutrition detective, had them look at different Cameroonian meals to kind of critique it and talk about the different nutrient groups and what they could add or subtract about this. So this was quite fun and interesting. For example, like this is cocky, corn and plantain. So of course they said some of them picked up that it's too high in carbs, no protein. The beignet haricot as well, similar discussions we had. So that was good. And then I had them look at the products. I bought a lot of these products from the pharmacies. The yogurt drinks, the Gino cocktail, different things. I had them review the ingredient list and then critique it. And this is the students doing it. So you can see the student here holding a pack of crisps and reading the ingredient labels. A lot of them had never done that before. And they believed that all these things from the pharmacy was better than buying fruits like, bananas and things they could have on the roadside, which was a lot cheaper. So we looked at all of these drinks and they critiqued the amount of sugar. So they were shocked to find out that a bottle of Gino-cocktail had 8 to 9 cubes of sugar. So a lot of them, it was just really teaching them to look at this for themselves, teach their peers, and then think about it for later. We talked about sugar synonyms, and it was also something, an eye-opener for them. So they could go from thinking that all these expensive drinks they get from the pharmacy is not as good as maybe having this one's, the healthy fruits they could buy off the street, and they could save money by doing that. So we did all of those exercises, and that was really great for the nutrition one. So the take home for them for the nutrition lesson was that if the sugar is in the top 3 ingredients on the list of the labels you read for your any food you buy, you need to avoid it because it means it's just too much sugar. And then day 3, we had exercise. So I had an exercise coach come in and teach them, the main types of exercise. And this was fun.
This is the blood flow.
So this is Mrs. Abunaw's coach. So she does exercise with him and her exercise group twice a week. So she introduced him to me kindly. And he came and it was amazing. Okay. Harmful substance avoidance. So I had them look at different tasks. We did a quiz about, harmful substances in Cameroon. So I wanted to understand the Cameroon context. And they sort of said the most common hazardous substances in Cameroon, the research shows, is appetite stimulants. Who would have thought? So a lot of patients would go to the pharmacy to get appetite stimulants because their kids don't have appetite. And pharmacists will sell them this thing called cyproheptadine. And instead of, counseling them to eat healthy and do a lot of things they can do to improve their exercise, they sold these appetite stimulants. And at least 3 of my students were actually on these things, the appetite stimulants. We all know about codeine syrups and the issues, illicit drugs, herbal teas that actually harm people, a lot of over-the-counter prescription medication that's misused, and then alcohol. So again, I had the students report on this. I was going to play this video, but in interest of time, I'll move on. But this was a group exercise where they were reporting out on harmful substances. This one was Mental Health Behavior Change Day. So this, this was one of the best moments was when they did this group exercise on motivational interviewing. So it's kind of coaching practice where you get a group together and try to talk to them about weight loss. So I gave them free range to do what they wanted. So they decided to be in a village. So their group setting is a village, and they were chatting in English. And I did a bit of a summary. So the lady in purple is a pharmacist. So there she's going through all of them and asking, what is your issue with weight loss, your challenges? They will say it, and then she'll give them some sort of, advice on it. And then this one here was the hood. So she's like the busybody Kongosa person who is just heckling everybody, and it was just fun. So you need to listen keenly. And I've just put like scripts here. If you can read a little bit of what's in the bubbles, is what they're saying.
How do they talk of the English? I have to snatch. Maybe small people get to look at it from America. You will shake your waist too, shake your waist, shake it. That's what you want me for that day. Anytime I want that, you store. Anytime I want that, I want store. It's really covered. Brenda.
Okay, so in the interest of time, I'll just stop. I can share that later. So basically, to kind of summarize, you had a bride-to-be who had an issue about her wedding dress not fitting, and the pharmacist was encouraging her and teaching her how to squat and how, it's not about langa. She said, this also call my name. And then the others were saying na langa. And she said, no. You had the Mecca, the businessman who couldn't exercise because of his business. And so she was like, the pharmacist said to him, park your car on the weekends and walk, and trying to give him strategies on how to cope. And then they were heckling him about the fact that he thinks that having a big stomach makes him, a rich man, and how he's going around chasing young girls. So it's just like, what it showed is that lifestyle medicine is not about prescribing squats. It's about navigating culture, identity, economics, and emotion. So it's skills and not just knowledge. So if you listen to the whole thing, you could hear the community voices and different things. So it was just really great seeing the students just come up with that in that short time. So I did a bit of research to kind of like Dr. Monye talked about research. So I looked at the outcomes of my teaching. It was 6 pillars, I thought, just to highlight this busy poster, which I presented at the British Society of Lifestyle Medicine. And what it showed is, I've just put an arrow there to where I think, just to focus the busy slide, is that I did a pre and post test for each of the sessions I taught them, and there was a knowledge increase from 44% to 78%. So they learned a lot, which is quite good. 100% of the students agreed the content was relevant to their future. 94% felt it improved their role, it would improve their role as a pharmacist, and all of them recommended that this should be integrated into healthcare education. So these are the sort of comments they said about the course. It shaped me to be a pharmacy student that would be able to incorporate lifestyle medicine in my field of studies. Swimming, they didn't know, for example, swimming is a type of sport. Some thought exercise is not only for fitness, but they didn't realize exercise is also good for mental health. So things like that came out, and it's all on this slide. I'll just move on from that in the interest of time. Okay. So what I also asked them to do as an exercise, I was going to have us do this here, but I'll just move on. But I had each of the students looked at the different pillars of lifestyle medicine, and then this was a course work which they had to do, and I marked afterwards to think about the relative for someone who suffered from something. They wanted to counsel them. Look at their nutrition, look at their physical activity, their stress management, sleep, social connection, and risky substance avoidance. Interview them about how they performed on this. And then based on the responses, come up with recommendations for each of the 6 pillars. And out of this recommendation, choose one final one for them to start with. And it was really good how they came up with a lot of, way they did that. And then I asked them to pledge one action for lifestyle medicine going forward. So they came up with all of this. There were loads. So I had 18 of this. I just put out 4. So I wish to educate people on screen time management. So for them, they realize it's a huge thing, managing your screen time. To educate family and friends on the effects of diabetes, how to use TikTok and social media platforms. So really, there was a lot they could do. I will skip this one. It was another Menti one, but just to save time, I wanted us to just look at, what you would all do going forward. Just kind of getting to conclude, how can you make changes is my recommendation here. So the best thing is to start with yourself. So assess your lifestyle, look at all those pillars and see what you can do. Integrate one change into your teaching or practice. So do something in your sphere of influence to do this, and then build collaboration with someone, right? So you cannot teach what you do not practice. So you need to start practicing. You need to do small changes to be able to then build onto the big one, and collaborate with others. Fund initiatives, start something. And because critical mass begins with conversion. So this is like the collaboration, which again, another one I started. These are 2 of my students, which Dr. Abunaw actually took into her pharmacy to kind of support them to learn a little bit more. And I just also want to encourage you. I know there's a lot of doctors and healthcare practitioners on this course. Please log on and join the British Society of Lifestyle Medicine and attend their conferences. There's a lot there that can help you to learn about what Dr. Ngwa had asked about, how to do this right. So these are, for example, courses they have on there that you can, webinars they run every month. You can follow that. You can actually sign up and do their core accreditation, which also teaches you a lot about lifestyle medicine. So I'll conclude now. Then I think I went over by 4 minutes, and I apologize for that. And please put your Q&As in the box. Thank you very much.
Thank you very much, Dr. Nafti. That was quite. You didn't go above time that much, I would say. I think it was fantastic presentation. I did enjoy listening to you talk. especially seeing you form the next generation of healthcare professionals. I keep saying to people, we were trained not as healthcare practitioners, we were trained as ill health practitioners. So we'll be trained to treat diseases and not to prevent diseases. And now we're starting to relearn all over again. Thank you so much for that. Now, I got one question for you. I know you did mention, this has come from one of our attendees, you did mention how you went into University of Boya and you got involved with the pharmacy students and the fantastic work you are doing to bring them into lifestyle medicine. Now, our attendees want to know, what is the pathway for young people in Africa to become lifestyle medicine practitioners? What must they come from doctor professions or other social professions? I think what you're trying to find out is we're dealing with people who are in the healthcare, like the pharmacists. What about the normal people, the sociology students, the chemistry students? What is the pathway to get all of them involved in this, as we've agreed that is a vital part of our healthcare system?
Mm-hmm. That's a great question. And I think, like I said, I put the slide there to say this is the ideal way to get it going. But I think we have to just think practical and go spheres of influence. Off the top of my head, and I'll invite Ula, who is in Cameroon, to kind of maybe help me there. I would say to start off with like what Dr. Monye has built, the Nigerian African, Society of Lifestyle Medicine. I know from the British one, which I've attended, that they welcome students. There's a lot of resources for students of every field. So I talked about healthcare practitioners because I did pharmacy, but social workers are on there, counselors, teachers. They invite teachers and everything. I think when I went there the second time, I took my son who was studying sports science with me to attend, and he actually really enjoyed it. So they gave free attendance for students. So he didn't have to pay, he just showed up, and it was amazing. So I would say register with the African Society of Lifestyle Medicine, even the British one, so we can share links. They have so many resources. Like I showed you, that screenshot with 6 webinars, that's just for the last 6 weeks for the British Society of Lifestyle Medicine. And if you click on it, they have webinars on different things. So join, one of these associations, and you start resources, and then you could partner with someone who can mentor you or be a coach, they'll lead you to the right place. Ula, I know, is in the, if someone is in Cameroon, I would say, Dr. Abunaw came and attended the course. So she's passionate about this. So if you want to hear more about the pillars and how that works, I would say get in touch with her. And they will also found out about the Cameroonian person who is leading the lifestyle medicine in Cameroon, so we can share their details as well. So people like that, it's just partnering, link, talk to people and just become a member of the tribe. Yeah.
Thank you so much. I think that's very, very appropriate. And I do agree with you. And I think I can see here that there is a pattern forming for us to enlarge lifestyle medicine practice in Cameroon by getting, and I'm so thankful that Mrs. Abunaw is here today, who would obviously be one of our champions as we take this discipline forward. Thank you so much, Dr. Navti. We will come back to you and our Q&A questions. We've got some further questions here for you, and then we can take it there. Chronic stress, as we've heard, is also another. I mean, you can eat all the good food you want and do all the exercise that you want, and don't smoke and don't drink. But if you cannot manage your chronic stress very well, then certainly, I think in one of our webinars, our president talked about the Wellbeing hypothesis. You're bound to be developing some chronic non-communicable diseases as well. So chronic stress management is very important. And here today, it's no other person to talk about this to us than Mrs. Joan Kila Konje. She is an integrative psychotherapist and counselor. She's a public health practitioner and is the founder of the Kintashe therapy. Did I pronounce that very well? Did I say Kintashe? That was like a British man, Kintashe. She's a counselor and psychotherapist based in Gloucestershire in the United Kingdom, and offers mental health support within 2 charities in the Southwest. Her clients mainly are young adults, university students from the global majority or the African continent especially. Those who are not in the West might not understand the level of discrimination, in inequality, racism that our young people do go through, and so mentoring them has a significant amount of support that they could get. Now, she's also been able to integrate the pillars of lifestyle medicine in her background, which is in public health research, and she's done it in a very culturally competent framework to foster well-being, both individually and within the African diaspora women group, like the Fireside, which is a group that she's very, very actively involved in. So she'll be talking to us about surviving to thriving. Remember, to survive doesn't mean you're thriving. You want to thrive rather than just survive. And she'll be talking about emotional well-being, self-care, and social connections as foundation of health. Mrs. Konje, it's a pleasure to have you here today, and I'll let you have the floor. Thank you.
Thank you very much. I hope you can hear me. Good evening, everybody. Well. Thank you so much, Dr. Ngwa. I appreciate that very kind introduction. Hello, everybody, and thank you to CamDoc for this opportunity to come and be part of what you're doing, the amazing job that you're doing in so many different ways to educate and inform our people for a greater good. And I'm just so honored to be here and to come behind such powerful speakers. I mean, Dr. Navti and Dr. Monye have just set the groundwork for us. And again, I echo what she said. How can you follow that? But I'll do my best and I will present to you what it is. And I also want to comment Mrs. Abunaw before she comes on. And we're so grateful that we can be here to do this. So I am going to be talking to you about the fact that you should not just thrive. We should not just survive, but thrive. And the whole lifestyle medicine pillars, Dr. Navti and Dr. Monye have presented them to you. So I'll be simply talking about stress or mental health and positive social connection. And there is the need for us to stress the fact that stress is different from being stuck in a survival mode. And what is that? A stress cycle, what I call stress cycle, is when, you know, your body, your brain is just acting. It's just activated by imminent danger and the emergency response to mobilize you to face the threat. So that is going to be short term. That's going to be manageable. That's going to be able to motivate you to even produce something or be very productive, and it's a beneficial kind of stress. On the other hand, we've got the survival mode, that is just when someone is in a state of the system being completely dysregulated, and then this is as a result of prolonged stress, unprocessed trauma, present or past, and that one can be very harmful. So it's necessary to distinguish between the two. Stress is a vital survival tool rather than inherently pathological condition. So you get stressed every day, but you can manage it. That is not survival mode. And so it's important to understand when you've come to that crossroad, when you've crossed over and shifted from the necessary temporary reflex of stress to harmful prolonged state. So it's necessary to highlight that because a lot of us don't know what the difference is. So, for example, I am currently, I'm currently very stressed. My hands are sweaty. I'm thinking I have to do this presentation. But the hope is that at the end of it, it will go away. I'll go back to normal and be fine. So that's normal stress. But if somebody is continuously activated after they've gone through whatever the immediate threat was, and they keep having this whole dysregulation happening, then they will be in survival mode. And so the question I will pose to all of us is, what might make us Africans here in the diaspora and back home be in survival mode? There's several factors that I could present to you. There's, for example, prolonged stress. I hope you can hear me. I seem to have frozen on my end.
Yeah, we can hear you fine. You're back now, yeah.
Okay, there's prolonged stress both at home and abroad. Thank you very much. And it comes from different reasons. There's the adaptation to the new culture here in the West, or adaptation from coming from the rural area to the urban areas. There's identity stressors. Who am I? I've come to this Western world now. I've forgotten. I have to change everything I was and adopt new ways of being. That can be very stressful. There's structural, economic, and situational structures. I'm just thinking primarily about what Mrs. Navti mentioned earlier on, the people who are caught up in the instability and things are happening back home, and how that can be very stressful. And some people are just holding that continuously. And there are other things around here. Some of us who've migrated here, and the system does not really work for us. I mean, people come in to do jobs. They've been called in to come and do jobs in care, and then suddenly there's no job, and you've brought your whole family in. That is a structural thing that you can really be stressed about, and it's been really impactful on some people. There's social isolation and loss of community. Loneliness is become prevalent in the UK, and I think it's also affecting us as a diaspora. And there's multiple losses and grief, both here and at home. Again, going back to the instability, I mean, there are people here who've lost relatives and they've not been able to grieve properly. There are people who've lost homes. I mean, the extent of the loss is really a lot, and all of that can really play on us and cause us to be very dysregulated. Limited resources here and back home, prioritizing. It leads us to a situation where we're just prioritizing the now. And there's no point thinking about long-term planning, because how can you, when you're only able to survive today? And also the cultural expectations on our part. I mean, we need to be strong, right? I mean, there's this whole talk of a strong Black African woman or the strong Black man who doesn't show emotions. He has to keep going because there's family to feed. There's a woman who has to keep the family's food on the table. So all of that, it becomes resilient, becomes extraction. And when it becomes extraction, you have nothing else to give. You've been squeezed like an orange. And that can impact on your body, and that can impact. And there's also that whole idea, if I take care of me, my gosh, I'm feeling guilty when I could send this money for somebody back home to do something with it. I mean, there is good intention, but it's also that whole not taking care of selves. And then there's survival based on the fact that we learned how to resist and how to be resilient on some coping mechanisms that no longer function in our new situations, and we don't know how to get rid of them. So we keep going. In the diaspora specifically, there's also unprocessed trauma. Many of us know that the way we traveled to here is very stressful. I mean, there are people in the US who've gone through Mexico and places, and the things they've witnessed, you cannot speak. And they move into the US and they just expected to carry on. And there are people here who've suffered so many things, post-migration. We're talking about discrimination. We're talking about racial discrimination and other discrimination. We're talking about stigmatization. We're talking about barriers of all kinds. You cannot be employed because the qualification you got back home does not work here. There's language barriers. There's accent barriers. Somebody's asking you, what are you? Well, I cannot understand you. And you're saying it over and over and nobody hears you. And you're forced to go to this whole internalized inferiority complex, that what Fanfanos talks about, black skin, white mask. We are performing. We're performing for an audience. There's a supremacy thing over us in so many ways, and we are performing to fit into this code switching, trying to be what we are expected to be so we can belong. And that leads to identity crisis. And then there's also emotional burdens, transnational responsibility. You're here and you're in Cameroon or somewhere in Africa at the same time, but you belong nowhere. You don't belong to either of these places because the responsibility back home are yours. Because home is always home. There's nowhere like home. You miss the food. What Dr. Monye was talking about earlier, there's some foods that we just want to have. You're in the middle of cooking in your kitchen and you suddenly go, I want my mami ero. Those things, they play on our minds. And then there's extended family responsibility. Wow, we all know what that's like. We send so much money back home and yet the problems never finish. Good ideas, good things to do, but do we stop and think about how all of this is impacting us mentally and emotionally? And then there's pressure to prove ourselves. I mean, I'm married to one of you doctors, and I know from conversations with him that it is non-stop. I mean, you are a doctor, but you're an African doctor. You need to prove. You come in with all your qualifications and you have to start from square zero to prove yourself. So there's always this process of this whole presenteeism. I have to be present because then I'm useless if I don't. Your value become attached to your work. You are known as that person at work. And there is so much that's happening in the background that suffers. And so we got all this emotional labor and everything. So all of that, I think, those factors put together, put in a situation where all of these things that we deal with on a day-to-day basis, the traumas and all of these discriminations, if we don't deal with them, I think we will be stuck in survival mode after we arrive here or even back home. When you face all the things that you face, Phyllis was mentioning earlier on about students who are struggling, the academics, they have all these pressures and stresses. So all of that can cause us to be stuck in survival mode. And so what does that happen to? What does that do to us? We suddenly get to this place where our system is dysregulated completely, and the flight and fight mode that somebody will have from a little trauma, from immediate stressor, live with us. And then we have an unhealthy system that affects our minds, our bodies, and even our spiritual lives and everything about us. So the self becomes very unhealthy. And what are some of these symptoms that we will face that tell us that we are in a state of survival mode? There's all of these things, and I'm just going to highlight a few of them. Burnout. burnout. It is really prevalent. And the only way some people know they're in burnout is when they're in that stage where they're either quitting their job or they've decided that, I'm going to end my life. Burnout is a critical one. And I think that it is important that we notice when we are carrying more than we can, especially with our jobs. I know we need the money and I know all of that, but we need to be aware of how far we have pushed ourselves. Also, I want to talk about this avoiding emotional pain. I mean, most of the time we go through traumas that we're carrying in our body and everything, and we are having back pain, for example, and you're thinking, oh, my body, you're taking paracetamol, you're going to the doctor every day. But it might be emotional pain. You're holding a trauma that you haven't processed, and your body is telling you, you need to stop and deal with this, and you're going, I just popping the pills. Pain is somatic. That is somatic. It's not only physical, it is emotional. And it's worth noticing that. And there's other things that we suffer. I'm going to talk about relationship breakdown. Majority of us, our relationships are breaking down, whether it's with our children or with our spouses, because we haven't dealt with some childhood things that we carry with us. It's not just a white man thing that we carry these things with us. It is real. The way you were brought up and the things that you were exposed to and suffer with, if you don't stop to deal with that, resilience will not go as far as you want it to go. And before you know, you cannot keep relationships. So it's advisable for us to look at these things when you see these symptoms, to understand that, first of all, they're unique to you. Everybody's not going to go through all these symptoms. We go through different things. Secondly, resilience levels differ. Just because we are all from Cameroon or Africa or everything, we are not as the same. It's not the same level of resilience. Know yourself. And then the way it will present the survival mode is different from everybody. So don't look at your friend and go, I can cope with that. Why come you not cope with that? That is not the way it should be. We should show compassion, and we should show compassion to ourselves. So the question now is, when the system or whatever he explains there no longer does not work for us and we cannot change it, what should we do? We are being challenged by Viktor Frankl, I love this, to change ourselves. Behavioral change. Dr. Monye mentioned that, and so Dr. Navti. There is something about behavior change that is very important. And this is what I'm going to talk about right now in terms of self-care. So self-care, for you, what does that involve? If I ask you what it is, and if we had time, I'll say go in the chat and tell me what your self-care means for you. Tell me so many things. That's lovely things that we are being recommended online in social media. I mean, there are books, thousands of millions of dollars and pounds are put into all these books telling us how to do self-care. Some people tell you go color, take time to take a bath, all these practices, very good practices. The only problem I have is that most of these self-care practices offer good, but there are quick fixes that kind of gloss over the systemic and deep-rooted causes I've already discussed with you before. They don't take those into account. And even when they offer solutions, they are just surface solutions. Without exploring the root causes, it really does not deal with the stress that we have been exposed to by the various things that I've explained already. So why is self-care important? Self-care is very important, and it can be physical, it can be mental, it can be social, it can be spiritual. It also can be individual. You can do it on your own. You can do it as part of the community or with somebody else. So it is very important, but it's also very important for managing stress levels, which is what we're talking about. When you take care of yourself, it will help you reduce stress, and the energy that's trapped in that survival mode will be released, helping you gain control of your life. So real self-care, I prefer to say real self-care, that really changes us, takes care of us and our emotional well-being. For example, involve things like boundaries, creating healthy boundaries and sticking to them. I know, we love our people. We are part of the people. People are our people. But if you don't put the boundaries, those people become the people that bring you stress, and you will resent them, whether you say it or not, you will, because there's frustration when somebody crosses your lines. We are very people, we're people friendly, but at the same time, we need to know when to put the boundaries and not feel guilty about it. Cultivating mental or flexible, or psychological flexibility, just knowing when to detach from those thoughts that are not true, because they come regularly and often does not make them true. You need to stop and detach yourself from them. Developing self-compassion, kindness skills, acknowledging vulnerability. You are not always strong. There are times when you need to admit to that. And I'm talking to most of our fathers and husbands in the group and our mothers who think that they can do everything at once. We need to come to a point where we say, I cannot do it. And that helps you to just take a pause. I mean, and begin to manage expectations. We have expectations from people that we don't even know what their season in life is, because we think that because they are our friends, they should be able to come and do what we expect them to do. So managing expectation will stop us being resentful, and our systems will do well. Also, identifying and clarifying your values. What are your values? Don't just react. Act from a place of value. Make decisions from that place. It's very fulfilling when you know that your core values are what are driving you. And also develop emotional intelligence. Yes, it's a buzzword. It is a buzzword, and every kind of person has spoken about it. But the truth about it is that when you know and you have emotional awareness, you can regulate yourself better. You have something that's troubling you. You can define it. You can name it. Is it anger or is it frustration? Or am I just a little bit unsettled about what this person has said? Knowing also the season that you are in is very helpful for your life and for others. It's not every season that you behave the same way. It's not every season that you respond the same way to the same problem or emotion. Just knowing that is very helpful. Other aspects that help you are spiritual practices. Most of us are believers in the one true God. But whatever you believe in that keeps you going, hold on to that. Practice gratitude. One of the things that people underestimate is harnessing the power of awe and wonder. Be curious. Look around and be curious about the other person and about yourself. That is very helpful with self-care. Cultivate mindfulness. Yes, another buzzword. It sounds like very foreign and Eastern and everything, but it's the simple things that we do. Just take a minute and stop. Take a minute and pay attention to how you're feeling. You've just seen a patient, for example, doctors in the house, and the patient has mentioned something about their mother who died or something. Take a minute. If it triggers something for you, maybe you're connecting to something in your own grief or something, take a minute. Pause before the next 10-minute session and just say, how am I feeling? Breathe. Go out, take a walk if you can. Assertion of power. Please, it's okay to tell yourself to say no. No is a powerful word. I know you've heard this. I'm just re-emphasizing. You can say it without over-explaining. You can say it without feeling guilty. Also, all of these all these self-care things I'm talking about, you have to rehearse, you have to review, you have to repeat. Practice, practice, practice. And when you've done practicing and it's still not working, give yourself permission to seek outside care. Find therapy. Therapy is not white man thing. Therapy is what we do every day when we sit and chat with people and gossip. It's just that maybe we don't do it in safe environment, and we need to do it where somebody has earned the right to hear our story. Get help. Doctors, there is doctors in distress. There's statistics that saying that there are 10,000 doctors in the UK in therapy, and most of them turn up when they are about to drop or fly over a bridge. I just pray that we can access these things. And then there's also positive connection, which is what I'm going to talk about soon. Group or one-to-one. Healthy relationships that Mrs. Navti and Dr. Navti and Dr. Monye talked about. Healthy relationships as part of the lifestyle pillars. So would you agree with me that this is not positive social connection? This is a family about to have dinner or maybe sit around and have a chat. Everybody is on their phone. I relate to that. I wonder if anybody else does. This, I don't think is social connection. Social connection is defined as a meaningful, you make a choice and you have a meaningful connection with somebody, constructive relationship with an individual, with a group, or with society, caring about you and you caring about them. That is a definition of positive social connectedness. And why is it beneficial? It gives you emotional support, reduces feelings of loneliness, resilience to stress, gives you resilience, motivates you to seek help, sense of belonging. I mean, we are naturally as Africans made to belong. This just brings you home in a good way. And it maintains good health, mental health for us. So connection promotes mental health by enhancing the ability to cope with adversity and challenges. These are some barriers that you might face when you're trying to connect, and these enablers will help you with that. We've only just mentioned technology. There are other things. There's loneliness, there's structural racism, those for which we can't do anything, but we can be supportive of each other while we're trying to find a solution to those structural ones. We don't fight the battle on our own. Being genuine, authentic. If you go into social connection like your true self, the outcome is always beautiful. So these things are the enablers will help us deal with these barriers. And an example of how, in my own way and with the help of a lot of other women and God's grace, I've been able to bring a little bit of social connectedness to help our community bring some kind of mental well-being. Has been through what I run, a monthly program that I run with the ladies online. It's virtual. We call it Fireside. In my language, it's called Ngai. It's that place where back home, women come together. When they've come back from the farm, they sit and they talk everything. They talk as the fire is burning and they're cooking for their families, as the corn is roasting and they're sharing their stories. It's that kind of environment where we come together purposefully to tell our stories, because our stories are all very valuable. We tell our stories, we create connection, we encourage, and we empower. And this is anything is brought to this space. But I must say, our husbands are not brought. Our marriages are not brought, because this is a space for us ladies, and the men will leave you at the door. But who stops the men from starting one where they talk about everything and leave us at the door? You're very welcome to start one, gentlemen. And so it is a space where we come and we share. And this is some of what the ladies have been talking about. Just wanted to have a feel to share with you of how this has impacted them. One of them said it's a good place to connect with sisters in Christ. Another one said it's a virtual space that nourishes their soul. And they talked about it increases collective resilience and growth through shared experiences. They talk about the fact that it's a psychological space where they feel safe and they feel that healing and revive after the time they spent with us. Some of them say it boosts their mental health and so on and so forth. It fosters collaboration. So it changes individuals. I must say some of the women coming haven't done the work of self-care, the real self-care. Some of them haven't, some are new to it, and we kind of support each other to be able to arrive at a place where we are nurtured and the other is nurtured. So my final thoughts on this today, and I'm about to end. I'm sorry if I've gone over time. My final thoughts today is there is a Banso expression. I am Banso. Bad Banso. And it says, with the will be will. And Albani Association members that might be here know this very well. It's translated, a person is a person because of other people. Beautiful foundation to build our lives on, because we are community. It's like Umbutu, right? We are part of the community. So that's a very good foundation. But if you have that foundation without walking alongside these pillars of lifestyle medicine that Dr. Navti so beautifully explained to us, and Dr. Monye as well, and proactively, I say proactively because it's something you have to pick up yourself, doing self-care plus positive social connectedness. This is the only way that we can enable that we arrive at the place of emotional well-being. Everything coming together so beautifully, and we will then thrive and not just survive. So, therefore, it will take an emotionally healthy African individual like you and I to be a thriving African community where lifestyle medicine will thrive, both in Africa and in the diaspora. So we do the behavior change and the care for ourselves. Then we come into community because we are better that way. With the will be will works. But if you are broken and you're struggling to know why you're dysregulated, you can't help me grow. So when we do that, we come together, it becomes a thriving society. So I want to say, please do the work like Dr. Navti said. Those who are teaching, do the teaching. Those who are taking up, take the taking up. And we come together and we do the social connection that lends us to thrive. So thank you very much for listening to this talk, and may God bless you all. Bye.
Thank you so much, Mrs. Konje. That was fantastic. I think you really did connect with our audience. I can see quite a few things on the chat forum there, and quite a few people are really appreciative for the fact that you're touching real life situations. And I do agree with you on a lot of things that you did say, and you mentioned resilience, which I think is something that we have talked before, and you're really touching all the points that we've talked before. You mentioned quite a few points here on how you can manage yourself and in self-care. I have one. I'll throw and I'm happy that you formed this group called Fireside. I'm going to throw this to you and see what your thoughts are. Now, we are getting a situation getting more common now. The Nigerians call it C-finish, where particularly the younger Africans tend to demonstrate some disrespect for the older ones when they come in here. But they wouldn't do that for the same person of the same age who will be, say, a Caucasian, for example. I'll give you an example. I just had to sanction one of my junior doctors from Nigeria a few days ago when I asked him to do a blood gas for me. And it was meant to be an arterial gas, but it came out, it was a venous gas. So I said to him, no, that's wrong, that's a venous gas. And he was arguing with me. And he wouldn't argue if I was a white consultant. So that is the typical kind of a C finish. So when people cannot deal with your stresses out in society, they tend to bring it into the community where they find it's a weaker spot and manifest. Do you find that in Fireside? And how do you manage that?
Thank you very much. That's a new term on me, see finish. I'll try and sit down with that one for a bit. I think what you're asking me is whether there is that complacency within the community. People think anything goes. I mean, there are some times when we have all these meetings and we tell everybody the time, and because it's us, they say African time, we'll turn up whenever we want to do. So we do that to ourselves, and it's a shame that it happens. It really is a shame. I think if you are really emotionally strong across the board, there's no need for defensiveness. There's no need to hide behind, oh, you're different, you're my brother. So no, the more respect at home. I mean, charity begins at home, right? And I think it's always that whole thing of we take ourselves for granted. We don't value what we've got. We don't value ourselves because of that internalized inferiority. So I'm passing it over to you. You are you. Who are you for me to be putting you up there? And if we begin to see each other as we are supposed to be, because we are whole. If I'm whole, I don't have anything to lose respecting you. I only don't respect you because I'm afraid that there's something I'm going to lose, right? If I feel that I'm whole and okay, I meet you on the road, I give you the same level of respect. That whole thing of I see the image of God in you, but also I am good enough, so you're good enough, so we are cool. I don't get that in the women with the women's group, that Fireside that we meet, because I think we come at the same level and we're growing to be at the same level. And thank you so much. I hope that answered the question.
You did. Thank you. I'm so happy. And you really touched it on that internalized inferiority. I take that on board. I'm so glad that you are doing the Fireside. I did throw it to Dr. Lukong and to Phyllis' husband that we should try and form our own house in the CamDoc where the men can come together and have that kind of Fireside as well. I'm sure it'll be a good thing to do. But thank you so much. It's been a brilliant talk. I did enjoy a lot of things you said. And I'm sure our members, our attendees also did enjoy your talk. I can see the chat is heaving. Now, the lifestyle medicine is moving, as we've seen. It's a worldwide phenomenon at the moment, but we haven't had the perspective from Cameroon. And I think it's quite important because we do have quite a lot of our attendees from Cameroon as well, trying to find out how they could get involved in this. And there'll be no other person to talk on this than Mrs. Ula Abunaw. Mrs. Abunaw is a lead pharmacist. She's a lifestyle advocate and manages a Rafa pharmacy in Limbe. If anybody around there, you should know Rafa pharmacy, very, very, very popular. She also has a master's in the public health in developing countries, and she's worked both in the public and the private health sector in Cameroon. Now, she would be able to navigate us through how transforming care can happen through the community pharmacy. This is quite important because you expect that the pharmacy job is to sell those medications to you and make profit. But here you are, you got somebody who can make those profits, but they want to instead sit down and talk to you about the things you can do that might not cost much, but beneficial to your health. So, Mrs. Abunaw, thank you so much for accepting our invite, and I will pass the floor over to you. Thank you.
Thank you very much, Vali. I hope, can everyone hear me?
I hear you quite good.
Okay, thank you very much, Vali. Thank you, CamDoc, for this wonderful opportunity. Thanks to all the moderators, my co-panelists, and all the participants out there. I'm recognizing some already from way back in our Nigeria days. And I'm really excited to bring in the local context. And following from what Joan said, today I'm full of gratitude for being the local connect among the panelists. Everybody is based abroad, but I'm based in the country. So thank you very much. So I'm here to bring in the Cameroon part of it, what we do. I was introduced into 1 minute, please, trying to get into slideshow mode. Okay. I was introduced into lifestyle medicine by Dr. Navti last year, and I quickly jumped into it because it actually already fitted what I do as a community pharmacist working within my community. Limbe has approximately maybe 200,000 people. In Cameroon today, we are looking at diabetes prevalence of 6.9%, hypertension about 31%. And looking at where I live, it's a mostly sedentary lifestyle because we are today motorbike reliant. Everybody jumps on a motorbike to go to where they want to go. It's not like in the old days where people used to walk. And a typical urban Cameroon diet is full of salt, oil, and consumption of lots of alcohol and lots of sugary drinks. And what I see on a daily basis is high volumes of medicines for these diseases being dispensed. And over time, I see the doses increasing and more medications added. So you see a patient coming today was on a bitherapy for hypertension. Next year, they're on a tritherapy. The following year, they're on a quad therapy. And remember, also here, very limited health insurance. So people have to pay out of their pocket, and it's a huge burden. And because most often they can't even pay, they can't even comply. They keep skipping doses. And I realized it was a big problem. So what could be now a solution that will not cost them as much and be less of a burden? And why Rafa Pharmacy, or why community pharmacy? Already in the Rafa, we do blood pressure checks, we do fasting blood sugar monitoring. We have a lot of people coming every day, every month. I just use like January 2026, we're able to serve about 7,418 persons. And in Cameroon, and I'm sure most of the Africa, many people like pharmacy because no waiting time, just come pick up what you're doing. The pharmacist is always there, you don't need an appointment. And there's that trust because for these people to see all the time. So at Rafa we already had some of these checks in place. And on a monthly basis, we have about 25 to 30 persons we are following that we check they come in every month to check their blood pressure, check their blood sugar, which is a huge opportunity. I had a patient whom we started monitoring in 2023. His age about 50. And when he came in, he was averaging a blood pressure of about 180 over 100. He had been hospitalized and put on medications. But this guy, when he comes in, he realized that he drinks a lot on a daily basis. So in monitoring him, we saw that his blood pressure was not stable. And we started advising him. We gave him a small manual and made him to come twice a month for checks. And we advised him to start reducing the alcohol, reducing a lot of the roadside food that he was eating. And today I can say his blood pressure is averaging about 130 over 85 from this advice and from also being compliant to his medications. So every dispensing visit for a community pharmacy is a huge opportunity. It's a coaching moment. And what is summary of what we do? This is a blood pressure manual that we have. We just have a manual. The patients keep it with them, and then they bring it in for us to record, and then they take it to their doctor's visit, so he sees how they have been doing over time. Also, we have a chat room where they can talk to me in private or to other members of my team. So last year, after I did the lifestyle medicine course, how have I been able to integrate it into my practice? Apart from talking to my patients as they come in for their BP monitoring, I first started with training my own team. Because remember, we cannot do what we are not taught. I work with nurses, pharmacy technicians, and other pharmacists. And lifestyle medicine was not in our training. I graduated as far back as 1997 as a pharmacist. So you can imagine what we learned at the time. So I started with training members of my team on what lifestyle medicine is and encouraging them to bring it into our everyday practice when dispensing and when doing the health checks. I was also able to partner with a nutritionist to come in for monthly consults. So when we see a client that will say, look, you really need to have a nutritionist talk to you. I'm not an expert. We got a nutritionist to come in once every month to see some of these patients at the level of the pharmacy. We've also started community outreach programs to workplaces, to institutions, like Dr. Monye talked about a workers' wellness program. I'm proud to say we've already gone to about 6 institutions now, where we'll go into an institution and have a lifestyle wellness talk to the employees of that institution. We write a proposal and we're invited to come and talk. As well as going into the community, like the quarters, talk to the quarter head. The quarter head gets the quarter together on, let's say, Monday, that is ghost town, is usually quiet. We'll go in there and then talk to the people about how to eat right, how to exercise, how to sleep, and the other pillars. And also we have WhatsApp is the most used social media platform in Cameroon. So we have a social WhatsApp page. So we try to send out weekly health tips on how to eat and how to exercise. So this is an example of a flyer that we share at the start of a week. This week we are saying start the week with movement and drinking water, and telling them what drinking water and exercise will do for you. So this is a very low cost way. It doesn't cost us anything to send out a flyer every week to encourage our people, and we'll have lots of good feedback. Many people come to say, Doctor, I started exercising because of you, because of your tip. I've drank water today. I did not used to drink water before. And you see on my screen also, I'm sharing some pictures of those talks I share. I talk about that we go to an institution and make a presentation on what we do. And our wins so far have been amazing. There's full team buy-in. Even within my team, I'm so happy to see them talking to clients about exercise, talking to clients about sleeping, sleep hygiene. So if you walk in, it's not just, okay, I cannot sleep, let's give you an antihistamine to help you sleep or melatonin. No, we try to ask you your sleep pattern and other questions. We've had invitations, as I said, to other institutions. Please, can you come and talk to our workers about their health, about what they can be to be productive. We've also had patients sharing progress, coming to tell us, Madam, I'm so proud I've been able to start exercising. I've been able to lose 2 kilos. My blood pressure was better today than it was last week or last month. And it's such a joy to see that. And these patients also refer others and tell their doctors of what we do. And the doctors call me to say, well, I'm seeing the amazing job you're doing. Keep on. They've showed me their manual. They've told me the advice you're doing. And our patients are becoming health ambassadors. What can we do? Right now, I know there are people in the audience who are from Cameroon, maybe other clinicians, other pharmacists, other nurses, just any other person. If you have a practice like mine that I work in my own practice, just one lifestyle question per client visit is good. Just asking your client that simple question that, do you exercise, is something. Yes, it's introducing the starting the conversation. And also collaborating with other health professionals, the other doctors, the internists, the cardiologists that have this huge burden of patients they keep seeing. Partnering with them to see what we can do to get the conversation into our community. Document and follow up patients. So Phyllis is into research. How do we get the University of Boya, the researchers, and Valentine, you're into research. Researcher of us, how can they help us now have a cohort, following up a cohort of patients in a more structured way. And therefore, we're able to show evidence that what we are doing works. So I'm happy to be a local connect. I'm very happy for this opportunity with CamDoc to share a little bit of what I'm doing. I want to emphasize that I only did introductory course about August last year, so I'm not even up to a year, but it's been an exciting journey so far. Already almost every week I have a speaking engagement. I had one last Saturday. On Monday, I have one last Saturday. It was Vista Prince workers. On Monday, it will be Societe Generale Bank workers that moving into committee to keep talking to them. And as a pharmacist, I'm saying medicines manage disease, the lifestyle changes the outcome. Incorporating lifestyle medicine advice daily through in-person talks, through social media, through community outreach program is a game changer and is very urgent for us in Africa, where we do not have sophisticated hospitals, we do not have the manpower to follow up all the complications that people are going through, and we do not have, above all, we do not have the financial means to pay for healthcare. Thank you very much.
Wow, thank you very much, Ms. Abunaw. That was succinct and on the point, and it's so good to hear the perspective from Cameroon. Thank you so much for taking this on board. You're being quite modest there to say I've only done the introductory lesson, but I'm sure from what you're speaking, it shows that you're far deeper into it and like a pace-setter, really. Thank you. And you did say medicine manage diseases, lifestyle changes, outcome. I totally agree with you. And one of the things that we tend to do in elderly medicine nowadays is to get involved in deep prescribing, getting people off medication that they've been for years. And you mentioned salt, sugary drinks, and alcohol as some of the ills in our society. And I think Dr. Monye mentioned the need for a food policy. There might be a deep ask, but does Cameroon have any food policy at all? Because when one goes to Cameroon, you see things like American Cola, the drink Planet. I think those drinks are just one step below poison, isn't it? But they are sold quite commonly. If you go to any occasion, you see them flooding the place. And I used to wonder why government will allow poison into its country. Do you know if there's any food policy in Cameroon at all about those things?
There should be, but I'm not versed. So when Dr. Monye was talking, I also wrote that down to now go deeper to find out what the policy is in Cameroon, because I don't know myself, but just as you say, these sugary drinks are so cheap now, so affordable, that it's made them flooded the market and they are over-consumed.
Yes. I'm quite pleased when you talk about partnering with the nutritionists, which is a very strong part of collaborative practice, which I'm sure in CamDoc we've said that many times before. And also pleased you talk about the community participation, being able to go into the community and speak to people. Now you're speaking to banks is certainly the way to go, and creating those health ambassadors as well. So we're so thankful for your talk today. I'm sure there will be a lot of questions coming in from our panelists, which we will take in the Q&A session, which we'll be going to very soon. But before we do that, let me just kindly acknowledge the presence of my very good friend, Dr. Zachary Salifu, who is a cardiologist in America. We did mention the American Cardiology Association's Heart Association guidelines before. And I'm also trying to acknowledge the presence of Professor Tiongachu, who, as we know, is our senior and now runs the Premier Healthcare Center in Douala, and Dr. Fotabo Assong, who is my national colleague dentist in Cameroon as well. It's a pleasure to have all of you here. Now we're going to move into our question and answer sessions. If anybody hasn't put their questions, please go on the Q&A section and type them there. I would take some of the questions that have not already been answered. I can see some have been answered. I think I've got a question from Eben here, said, with non-communicable disease rising rapidly across Africa and among diaspora community, what makes a prevention-first lifestyle medicine model an immediate priority rather than a long-term aspiration? Dr. Navti, do you want to take that question? I can. Sorry, you're muted.
Yeah, sorry about that. Yeah, I lost you.
Can I do it? Can I repeat it again?
Please, yeah.
Yes, it says, with non-communicable diseases rising rapidly across Africa and among diaspora communities, what makes a prevention-first lifestyle medicine model an immediate priority rather than a long-term aspiration?
It sounds to me like the answer is in the question itself. Because Dr. Eben has pointed out it's a priority, and like Dr. Monye showed us, the evidence is compelling. Hypertension among, Africans in the diaspora and in Africa is rising. There's so much that before was a rich man's disease, wasn't something that hit us in Africa and as Africans in the diaspora. But now the evidence is just showing that it's something we need to deal with immediately. So it's something which we need to, there's many strategies that Dr. Monye talked about how we can start. So I think, talking about education, that's probably maybe longer term. But from a policy perspective, these groups that we're forming, the African lifestyle medicine groups, can just help us if we all engage into it and get the lobbying and the policies going. We can actually get this moving. So I feel we don't have a choice. And I think the other thing I wanted to, a lot of the talks, I hope my talk didn't add to that and the others, is that lifestyle medicine is not a standalone. So it's not lifestyle medicine or tablets or surgery. It underpins. So it should be something that goes alongside. It's not just prevention, but when you're treating any condition, like, Mrs. Abunaw said, Ula said, ask them a lifestyle medicine question. There is always 1, 2, 3 that you can pick on. So again, I see it as we have no choice. It's something that we should be doing, and start doing what you can do. And for practitioners out there, educate yourself on how you should do it right if you don't feel confident, like Ula did. Mr. Bono came, did this 60-hour module on lifestyle medicine. She went back 2 days after she went, she was showing me pictures. She had all her pharmacy. We all have spheres of influence. All of us, we work with people, with our families. Start with yourself, go to your family, anybody, just talk about what you've learned. And that's how we get it going, not waiting for a long, it's not a long-term thing. We can start tomorrow. We just need to start. I hope that answered the question. Yeah.
You did, yeah. Thank you so much. Now there is a question that somebody has asked: what really is this lifestyle medicine? Mr. Abunaw, I'm going to let you answer that question. You are muted. Great.
Yes, thank you, Valentine. Lifestyle medicine is evidence-based medical specialty, which, just as Phyllis has said, is complementary to the other conventional medicine and other forms of medicines out there. And it uses therapeutic lifestyle interventions to treat, reverse, improve chronic diseases such as diabetes, hypertension, obesity, and some cancers. And the emphasis here is treatment. Dr. Monye said in the beginning, there is lots of evidence today to show that somebody who has diabetes, who has hypertension, it can be reversed with lifestyle medicine. Yes.
Thank you so much. And that I think I would agree with that. Emphasis has to be placed. Remember in my early years as a doctor, we should think that once you've had diabetes, that is it. You have to live with it. But I think the evidence is on the contrary at the moment. Now, somebody asked another question here. What is the most common and quick way one can get relief temporarily from state of severe stress? Let me first of all get a disclaimer here. We are not giving people practical advices how to deal with it, but also having general conversations. So what we're going to say, you have to, if you think that you have any severe medical or psychological problems, please contact your healthcare provider. I think I know part of the answer, but I'm going to ask Mrs. Konje if she wants to say a word or two. What is the most common and quick way one can get relief temporary from the state of severe stress?
Oh, thank you. I like the disclaimer you put there with regards to seeking professional help. I think that's very important. I would have been saying that as well. Severe stress, that is a big word. Like everything else, and the way I would with a patient or client in front of me is first of all, try and look at the root causes. But if you want an immediate, because the only way to get rid of stress that is severe and chronic is going to the root causes. But if you're sitting in a situation and suddenly there's a collide and you feel very dysregulated and all, grounding. You need to first of all ground yourself. Grounding techniques are very useful. You know, when you have heard about using your senses and just be present. Just be present in that moment to make sure that it doesn't get worse, because your mind can start playing, your body can start responding to that. And also there's a whole thing about soothing yourself, your breathing. You know, how are you breathing in that moment? How is your breathing? Because if your breathing is going very, very fast and if you try and calm it down, it's just to bring you back to earth. Because stress is always provoked by what's going on up here, what's going on here and everywhere. So you just want to come back into your body. And finally, I have to go back to this. Seek help. Just seek help. Because when you say severe stress, the first thing that comes to my mind is trauma. I'm thinking there's so much going on in there. But immediately, wherever you are, just ground yourself. That's what I would say.
Thank you very much. And I do agree with you on that as well. Now, sometimes when I'm in Cameroon, I like traveling with those commercial buses because it can be a drama. And for somebody who lives in a society which is highly stressed, sometimes just seeing those boys talk, particularly those people who are selling those products, see how the advertises is kind of a fun time. So somebody has asked a question here. In Cameroon, most activities are not properly regulated. How does the public distinguish qualified practitioners like Mrs. Ula from the numerous charlatans we find on the streets and also common on the social media? Mrs. Abunaw, that falls on your laps.
Wow, that's a tough question to answer. I don't know if people can actually distinguish, but I just know as a practitioner, you have to make a difference where you practice. So let's say they walk into my pharmacy and they walk into a pattern medicine store. The way I talk to them, the way I receive them, they would know I'm a professional. It's all about professionalism and ethics. So if they see the way you approach, you know that this person, I talk about PG, he don't go school past that other man. They come in, they tell us, Master, they ever gone over that man for road day? But the way you don't talk for me today, as I say, you really know the walk past that man. So it's very interesting because they don't even know the difference between me and that person on the roadside who has a small box. They don't know. But when you talk to them well and you just, they now say, I'm going to come in for you now. The way you talk for me today, that other man, I don't go there. You know, don't know that one. So I think as professionals, practitioners, we can distinguish, we can make the community distinguish by professionalism and the way we attend to them. But then it also falls back to policymakers, regulators, that's the country that leads that, to see how they can protect the population, because many people are vulnerable and do not really know where to go.
Absolutely. I do agree with you. Absolutely. Thank you so much for that response. And I've got a comment from John here, which I find quite interesting. And I'm going to read it out. He says, it is amazing how people in the West want to eat African food and people in Africa want to eat Western food. I think somebody did make that comment in one of our trial. I don't know if it was me or some other person saying, you find it frustrating that you go to Cameroon. If you go to Cameroon, you drive around that Njombe area, you look at the pineapple there. Oh God, my God, you don't have that kind of pineapple anywhere. And then you go visit your friend and he gives you pineapple juice from France. And you're like, this is what I'm running away from. And then you go, or you go somewhere and they give you a fried, what they call it in Cameroon, Irish potato. It's been fried and stuff like that. And you're thinking to yourself, you got the best food. In sociology, there used to be a concept called the healthy migrant effect, which means that the people coming from those countries, African countries, used to be much healthier than people living in the West. But it seems like getting a bit reversed now. I mean, COVID, we saw that many people died in the West than in Africa. And those who died in Africa were actually the people who are supposed to be well-to-do, who have now tried to adopt the Western lifestyle because in their warped mind, they think that's the best lifestyle. I think one thing that lifestyle medicine will be teaching our people is that it is really not, and we need to start reversing that as well. Now, I got another question here. Now, Ula, this is for you. How can pharmacists balance pharmaceutical care with advocacy for non-pharmacological therapies? I'm not sure I got that question quite well. It looked like it's going to talk about remuneration here.
Yes, yes. As soon as I came back from my course with all my excitement, I started preaching to a friend who walked into the pharmacy and needed a medicine for sleep. And when I went on and on about sleep hygiene tips, she's like, I said, my boy, how you make money? So you don't now. So if you don't buy medicine, how you do their work? So that is the challenge we have. I have to pay taxes, I have to pay bills, rents, and all. At the same time, I have to do what is best for my patients, right? So to balance, I think there's a remuneration, but it's not overt. So if Mami Mary comes in and I encourage Mami Mary to come for her free blood pressure monitoring checks, she buys her medication. Mami Mary goes to the quartier and tells Mami Lucy, say no be go that other place again. If you go for that woman, you know go only say you mercy, he go add advice on top when are free. And so the remuneration comes, but indirectly through that word of mouth marketing from other clients. And also even remuneration is not only financial, as you know, that reward to know that you have changed the life of one or two persons, make them live healthier, is also a very good incentive for any professional. As you yourself said at the beginning, when we went to school, it was not like, it was probably illness professional, not health professional. But now in lifestyle medicine, we are seeing we have to be health advocates. So the remuneration comes, and actually there's increased traffic, I tell you, when you start giving. And even when we go out, they say give these talks. For example, I'm going to an institution to talk. Indirectly, there are many of them there, they are not my clients. They start asking, Madam, so your own pharmacy now which one? Well, that's where they will start coming. So you go out there as you advocate, and you start having the remuneration through even other things they come in for.
That's true. That's quite true, and I see your point quite well. Thank you so much. I think Professor Ngachu just said very good answer, Ula. Remuneration may not only be financial. Absolutely agree with you. The satisfaction of your client is also a good remuneration as well, and the respect that you're going to get. Now, we were meant to last up to 20 hours, but we've gone 15 minutes above. I do apologize. You can see how engaging our speakers or how passionate they were. There's just no way I could have stopped any of these speakers. You can bear with me. The moderator was a difficult time because I have to make sure that I understand what they are saying. And they said, from the chat forum, you can see that really we got the 4 best speakers on this talk. I want to thank you so much for being here. Now, we've stopped our Q&A session, but we wouldn't go just yet. I would invite the chairperson of CamDocUK to give us some closing remarks, then I'll come back and close the seminar. Dr. Linda Bello, if you can give us some closing remarks.
Thank you, Uncle Val, as we fondly call you. It's really been an amazing webinar. I want to thank all of our panelists for such an insightful, practical, and inspiring presentation. And on behalf of CamDocUK, I would really like to express our sincere appreciation to Dr. Ifeoma, who has left, Dr. Phyllis Navti, Mrs. Kila, Joan, Konje, and Mrs. Ula Abunaw for sharing their expertise and experiences so generously with us. They've all done this pro bono. They've come to practice run. They've been really helpful. So we really thank them for that. Today's discussions have powerfully highlighted the critical role of lifestyle medicine in improving health outcomes within the African and diaspora populations, and the importance of prevention, education, and community engagement. We're also grateful to all our participants from across the UK and internationally. So we had a lot from the US, we had from Botswana, and of course from Cameroon. And I believe Professor Asongalem from the University of Boya is on the chat today. I've just seen his name, and I believe that he's worked with Dr. Phyllis Navti. So we're really grateful that he's here today. So thank you all for being part of our CamDocUK community, for your shared commitment to advancing health and well-being. This webinar was recorded, is being recorded. It is on our YouTube channel. Please do share it with your loved ones, the ones that have not been able to attend today, because as we said, what we really had here today were 4 fantastic speakers. Each of them could have probably had a webinar on their own with all the knowledge that they brought to us today. So have a wonderful evening, and we look forward to seeing you again soon at our next webinar. Thank you, Uncle Val, for your excellent moderation. Thank you, my co-moderator, Anna Mbene. Hopefully we'll see her in a minute. Thank you all. Good evening.
Thank you so much, Dr. Bello. It's always a pleasure, and I must say it's always an honor to work for you. We are coming to the end of this fantastic webinar. Unfortunately, I wish we were going to come to the end because I enjoyed every minute of it, and I'm sure you do. What has been discussed today has gone to add up with the things that we have talked in the past. So we've had webinars on nutrition, on exercise, on resilience. You're welcome to go to our website, www.camdocuk.org, and watch some of those other webinars. As our president has said, this webinar has been recorded and it will be put there as well. Share that with your close ones, your family, your friends, and you can get the conversation going. It is certainly that when we have some of these webinars, we also form avenues for collaboration. As you can see, Ms. Abunaw is doing something fantastic in Cameroon, and now she is collaborating with Dr. Navti and with our students from Boya. And we're hoping that I can see a lot of our doctors from Cameroon are on the webinar as well, that circle will grow bigger, and before you know it, the movement will become very stronger in Cameroon. And I'm sure our chairperson would be able to agree with me that CamDocUK is always very willing and happy to be part of that journey, because it's a journey for goodness. I want to, at this point, thank all our panelists, Dr. Monye, who was left, Dr. Navti, Mrs. Konje and Mrs. Abunaw. Thank you so much for your fantastic talks and for taking the time to be with us. For those who don't know, we always have a trial run before this one, so they've been here before on Wednesday, and we went through this to make sure that we tick the boxes. So they've given us a lot of their time this week for this webinar. We do appreciate it. We're thankful for that. I want to thank our co-moderators, Dr. Bello and Dr. Mbene, for the fantastic job we've been doing behind the scenes. And most especially, I want to thank our attendees. We got a record number today of people who've been listening, and most times people listen more than one in a group. We're thankful for your participation. We're thankful for your attendance. We hope we'll get a conversation going behind the scenes. Please engage with CamDocUK through our handle www.camdocuk.org. Please fill the survey, which is on the chat forum, so it tells us what we can bring to our audience that will be useful to them. Again, thank you so much, and God bless you. So I think our webinar is come to a close, but we'll ask our panelists and co-moderators